Pituitary tumors lead to an excessive level of the secretion of the hormone adrenocorticotropic. These tumors can be non-cancerous, called pituitary adenomas, and they can affect women 5 times more often than men. Adrenal tumors are also most often non-cancerous and cause Cushing's disease by increasing the secretion of cortisol into the bloodstream. Ectopic secreting non-pituitary tumors are most often small cell carcinomas of the lung. As primary sources of cortisol, the pituitary and adrenal glands are considered endogenous sources, whereas when the tumor is located in a place within the body that should not be secreting cortisol, they are termed ectopic, meaning from outside. Another risk factor is long-term corticosteroid therapy, such as patients with asthma, COPD, rheumatoid arthritis, lupus, and inflammatory bowel diseases such as Crohn's and ulcerative colitis. These tumors and long-term corticosteroid therapy all result in elevated levels of cortisol. As we stated earlier, cortisol plays many roles within the body, and when these levels are excessive, we can see abnormal results. One of these is related to cortisol's use in the metabolism of fats and carbohydrates. Weight gain can be a common manifestation of Cushing's disease and is seen in 3 distinct areas: the trunk of the body, the face, called moon face, and the cervical area, which is called the buffalo hump. Another effect is due to the cortisol-induced insulin resistance leading to glucose intolerance and can even cause diabetes mellitus. Patients also suffer from skin, muscle, and bone complications. These are due to the cortisol's interactions with the synthesis of proteins, leading to muscle wasting, bone reabsorption, and the loss of collagen. It is the loss of collagen that leads to weakening tissues and the common characteristic of the purple stria often observed in the truncal area of the body. The elevated cortisol levels can also lead to increased vasoconstriction and hypertension, making these patients susceptible to metabolic syndrome, a syndrome characterized by abdominal obesity, hypertension, glucose intolerance, and dyslipidemias. Up to half of patients who are diagnosed with Cushing's disease may also have mental symptoms due to the effects of cortisol on the hippocampus, creating problems with learning, memory, depression, and even schizophrenia.